Welcome to the Lifestyle Medicine Update. I'm Dr. James Machino. Our research article today was published on Medscape on July 14th, 2016. It featured an interview with the president of the European Atherosclerosis Study, Dr. Catapano. Now, a key point in the interview dealt with the subject of the bad cholesterol, LDL cholesterol. We've known for a long time that higher blood levels of LDL cholesterol increase the risk of heart disease and cardiovascular death. So it's the LDL cholesterol that actually deposits cholesterol in the wall of the artery that leads to progressive narrowing, a thing we call atherosclerosis. Now, the more you narrow your arteries, the greater is the risk of total blockage of blood flow, which leads to heart attack and ischemic stroke. Now, in a diabetic, narrow blood vessels causes decreased blood flow to the lower limbs, to the feet, and to the toes, allowing gangrene to set in, which sets you up for the need for an amputation. Now, Dr. Catapano re-emphasized that high LDL cholesterol is a main culprit in the risk of heart and cardiovascular disease, which are really the leading killers in our society. He makes the point that all randomized studies conducted to date show that the safest blood level of LDL cholesterol to have is under 70 milligrams per deciliter, or 1.8 millimoles per liter. In Canada, we use 1.8 millimoles per liter. In the United States, they use milligrams per deciliter. He also makes the point that for people who have not had a heart attack yet, but they have an elevated LDL cholesterol, that lifestyle therapy comes first. He states, physicians should insist that patients make all efforts to improve their lifestyle, even if they're on drug therapy to lower cholesterol. Now, the proven ways to lower your LDL cholesterol through lifestyle is to avoid beef and pork products and avoid high-fat dairy products, no milk or yogurt above 1% milk fat. Avoid butter, cheese, cream, ice cream, whipped cream, and so on. Avoid deep-fried foods and foods with a lot of trans fats. And eat more of the foods that actually drag cholesterol out of your body, that are proven to lower cholesterol in your bloodstream. Beans, peas, artichokes, soy products do that. And consider supplementing your diet with either psyllium husk fiber, ground flaxseed, or oat fiber. These all lower cholesterol. And of course, doing regular endurance exercise, staying at your ideal body weight, also helpful. Now, the takeaway message here is that, first of all, you want to know your LDL cholesterol. Make sure that it's under 70 milligrams per deciliter or 1.8 millimoles per liter, whatever is on your blood lab reports. Now, if it's higher than that, then get more aggressive about your diet and lifestyle and speak to your doctor to see if a cholesterol-lowering medication might be appropriate in your case. But don't minimize the importance of diet and lifestyle, as in the majority of cases, diet and lifestyle alone can optimize your LDL cholesterol in the primary prevention of heart and cardiovascular disease. And of course, other things can affect your heart disease risk. The older you get, the greater the risk. And men are at a greater risk than women. Smoking, family history, total cholesterol, HDL cholesterol, triglycerides, homocysteine, there's a whole bunch of things. But LDL cholesterol is the transport vehicle that actually sticks cholesterol right into the wall of the artery, causing progressive narrowing. It's the main driver of heart and vascular disease. As such, it deserves a great deal of attention to prevent heart attack, stroke, and other vascular problems. Now, remember that in many cases, the first symptom of cardiovascular disease and atherosclerosis is a sudden death heart attack. In 40% of cases, it's the very first symptom that you have. You don't feel your arteries getting plugged up with cholesterol, often until it's too late in many cases, where the first symptom is sudden cardiac death. Now, the most recent 2016 findings from the Framingham Heart Study show that men are more than twice as likely to die from sudden cardiac death than women are. So men ages 45 to 70 roughly have a 10% risk of sudden cardiac death, whereas women it's about 3 to 3.5%. But those with cardiovascular risk factors, like a high LDL cholesterol, the risk is much greater. And if one of the risk factors is high blood pressure, the risk goes even higher again, because high blood pressure is also a biggie. So know your cholesterol numbers and, of course, your blood pressure. And throughout your lifetime, use diet and lifestyle to help optimize your values. There's a lot riding on it. Now, I've included the link to the published articles below in case you want to do some further reading. And so until we meet again, I'll encourage you to eat smart, live well, and I know you're going to look and feel great. Thanks for watching.